Hi, this is Dr. Kathleen Hallinan, and we're continuing our talk on weight loss. And today we're going to do the first weight loss medication that you should know about to help you with getting the weight off. This medication has been around for a long time. It is called Phentermine. It is very safe, it's very effective. It's much better than a lot of people want to take the over-the-counter stimulants. Be very cautious of those. People can get a lot of side effects from those. They're not FDA regulated. We really don't know what's in a lot of them. So if you are at the point where you want to take something for your weight to help you succeed, I would strongly recommend talking to your physician, and if your physician doesn't feel comfortable writing Phentermine, because a lot of physicians don't, it's a controlled substance, then have them refer you to a bariatrician, which is the name for a physician who does medical weight loss, or a physician who feels comfortable writing for Phentermine. And we'll go over how to use it. It's very safe, it's very effective, it's approved by the FDA for 3 months at a time. It can be used off-label for longer than that, meaning you make a decision that the risk outweighs the risk is not outweighed by the benefit of treating, and it takes away the perseverating thought, the thinking all the time about food. When you talk to people and they're food addicted or they're having a really difficult time getting the weight loss, over and over you hear that, God, they just can't stop thinking about food. And when you start them on Phentermine, you find that they come back and they say, I just don't think about food anymore, which is a wonderful thing. That being said, you must do what we talked about in the last talk, which is you must pick a dietary strategy and stick with it, because the medication doesn't do it for you. It allows you to not think about food all the time and thus stay on the diet you have chosen. Have I had people on Phentermine that didn't listen to this and overate the Phentermine? Yes. So make sure you do what we talked about last time. Pick a strategy that you know is going to work well with your personality, your lifestyle, and then, and only then, consider starting something like Phentermine so that you won't be thinking about food all the time, and it can be just a conscious decision that, okay, I'm going to have this much for breakfast and this much for lunch and this much for dinner and this little bit is going to be my snack. It will help you succeed. So here's my board again. So Phentermine, that's the name of the weight loss medication. We always check blood pressure and heart rate prior to starting Phentermine. One of the risks of Phentermine is that it does have the potential, because it has a little bit of a stimulant effect, to raise heart rate and blood pressure. So we check those first. Generally, I also check thyroid functions, and sometimes we'll check what's called a metabolic panel. So those are things you want to know are normal before you start people on Phentermine. And then it's taken once a day in the morning, so it doesn't disrupt your sleep or anything. And then I follow people up in 1 week after starting it to recheck their heart rate and blood pressure, and then once a month thereafter. That is the safe way to do Phentermine, and that is how it should be done. So find somebody, if your own physician does not feel comfortable, find someone who does feel comfortable. It is a controlled substance, but it is very effective, and try this in addition to whatever dietary strategy you have chosen. And then it's once a day. It's FDA approved for 3 months. And so we had asked one of the professors from the Cornell weight loss program, well, how long after 3 months do you have to wait before restarting it? And he said, really, you can continue it. The next day was his answer, because you're at that point, you can use it what's called off-label use. And it's a decision that your physician makes with you about the fact that the benefit from the weight loss outweighs any risk of continuing on the Phentermine. Some people have a concern when they hear Phentermine because they know the history of fen-phen. Phentermine was one of the 2 components of fen-phen. Fenfluramine was the one that was taken off the market. Fenfluramine did affect people's heart valves. It worked through a system called serotonin, and there are serotonin receptors on heart valves. So that is the second fen in the fen-phen drug that was taken off the market. Phentermine was not the culprit and is very safe in terms of heart valves. So just so you understand the history and the difference in case you have that in the back of your mind. Well, what about that fen-phen thing that was bad? So, okay, I hope this has been informative about the phentermine option for you. And again, pick a dietary strategy. Talk to somebody about considering starting on phentermine. And next time we'll go over some of the other medications that are also options. All right? Good luck, guys. Thank you.